Canadian situation first.
The number of cases is still increasing rapidly. On Wednesday, I spoke with Premier Kenney and offered whatever help is needed to keep Albertans safe. I also spoke with Mayor Iveson of Edmonton and Mayor Nenshi of Calgary. I let them know that we're ready to assist in any way possible. In Ontario, the second team of healthcare workers from Newfoundland and Labrador arrived this week. They're joining the first team and the armed forces members to help in Ontario and Toronto hospitals. Right across the country, we have to continue doing everything we can to slow the spread of the virus. One of the ways to do that is with screening and testing. So far, we've distributed more than 26 million rapid tests to the provinces and territories, and over 1 million directly to workplaces. Millions more are ready to be deployed. Supporting businesses, organizations, and the public sector in accessing rapid tests is key to identifying and isolating cases and therefore reducing the risk of further outbreaks. That's why we're making it even easier for everyone to access these tests. In Ontario, small and medium-sized businesses and organizations can now get rapid tests at over 40 Shoppers Drug Mart locations. Additional distribution locations and pharmacies will be added soon. Testing works. In April, we invested in the Stay Safe rapid screening program in the Waterloo region in partnership with the Ontario Government, Communitech, and the local chambers of commerce. In just the first 2 weeks, more than 120,000 free rapid tests have been distributed to over 1,500 businesses. Cases have been found in asymptomatic people who had no idea they were positive, but because of the test result, were then able to isolate to prevent transmission. We're funding similar partnerships right across the country. In Nova Scotia, local public health has been hosting regular rapid screening pop-ups. In Alberta, Suncor is using 300 rapid tests a week for their workers. We need more of these great initiatives because they work. To help, our government will continue to secure tests and get them out to where they're needed. Rapid tests can be requested directly on a new federal portal, which can be reached through canada.ca/coronavirus in the Limiting the Spread section. More screening and testing means safer workplaces and less community transmission. And that will help us reopen our economy faster. À propos de l'économie, ce matin, on a appris.
When it comes to the economy, this morning we learned that 207,000 jobs were lost in April because of the difficult but necessary measures taken to fight the third wave. Since the beginning of this crisis, our government has fought to support Canadians. If you have lost your job, we won't let you down. The more flexible EI, employment insurance regime, and other measures are there for you. Currently, the best thing we can do for our economy is to end this third wave as quickly as possible. In addition to all the other efforts we've made, we are continuing to provide vaccines to Canadians. On Wednesday, Health Canada approved the use of the Pfizer vaccine for youth aged 12 to 15 years. This came after a rigorous, independent scientific review. The experts concluded that the vaccine is effective for this age group. This is a step forwards. It will allow us to further fight COVID-19. So far, more than 18 million doses of vaccines have been sent to the provinces and territories as planned. Next week, there will be another 2 million doses of Pfizer vaccines.
50,000 doses were administered across the country. That's an encouraging number. And here's another one. 41% of adults in Canada have now received at least their first shot. I want to thank the provinces and territories for working hard to get Canadians vaccinated as quickly as possible. And to all the healthcare workers who are part of this effort, thank you. Vaccines are our way out of this crisis. When it's your turn to get your shot, do your part by making an appointment as soon as you can. If we keep looking out for each other and doing what we know needs to be done, we will get through this. On that note, today, I also want to talk about our efforts to fight COVID-19 around the world. We've seen what we've seen happening in India is heartbreaking, and I know we all want to help. Last week, we announced $10 million in support for the people of India through the Canadian Red Cross. This week, we sent a first cargo plane with antiviral medication and ventilators, and there will be more to come. Again, let me reassure everyone that what we're sending is surplus supplies, so it won't compromise our response here in Canada.
To end this pandemic, here and elsewhere, we need to fight the virus and variants around the world. That's why all countries who need it, all countries need to have access to vaccines and treatments, and we must work together to ensure that no one is left behind.
Countries access tests, treatments, and vaccines, we will make an additional contribution of $375 million to the Access to COVID-19 Tools Accelerator. Internationally, Canada has always been a strong advocate for equitable access to supplies and vaccines. We've mobilized over $2.5 billion in response to COVID-19, making our government one of the top contributors to the global efforts. Together, we can continue to deliver life-saving vaccines, tests, and treatments to the world's more vulnerable. We also recognize the important role industry has played in developing life-saving COVID-19 vaccines. We've been working with partners at the WTO to find a consensus-based solution and are ready to discuss proposals, in particular for COVID-19 vaccines. We remain committed to finding solutions and reaching an agreement that accelerates global vaccine production and does not negatively impact public health. This morning, I'd also like to say a few words about Bill C-3 that received royal assent yesterday. This legislation will help restore trust in our criminal justice system for survivors of sexual assault and for all Canadians, while making sure that everyone is treated with respect and dignity. Of course, this wouldn't be possible without the efforts of Rona Ambrose, whose Bill C-337 was the foundation for this legislation. I want to thank Rona for her leadership on this issue and her support in getting this bill through.
In closing, I'd like to remind you that it's important to continue to be very careful. While vaccination continues, local public health directives must be followed. Mother's Day will be very different again this year, but it's nonetheless a time to think of our mothers and thank them. One thing's for sure, your government will always be there to support mothers and their families during and after this crisis. I know that for many people it's been too long that they've not been able to hug their mother, but we can't give up. We need to continue to work together to get through this third wave and take advantage to be able to take advantage of better times later. And I would like to say that we have Ministers Haidu, Gold, and Eng, but first of all, our public health officials will speak.
Bonjour à toutes et à tous. For the numbers update, we'll focus on the current weekly averages that tell us how COVID-19 is trending now. You can find more numbers and trends at canada.ca and discussed in my statements and tweets. This wave continues to challenge us, but we mustn't lose hope as the finish line is getting closer. The decline in national case counts has slowed to an average of over 7,700 cases reported daily over the past week, and the number of people experiencing severe and critical illness remains high. Over the past 7 days, an average of almost 4,200 people with COVID-19 were being treated in our hospitals each day, including over 1,450 being treated in intensive care units, and there were an average of 46 deaths reported each day. This week has seen a number of important developments on the vaccine front, including the announcement of significant increases in vaccine supplies starting this month. To date, almost 15 million doses have been administered providing almost 42% of Canadian adults with a first dose of protection. As well, this week, Health Canada authorized the use of the Pfizer-BioNTech vaccine for safe and effective prevention of COVID-19 in children aged 12 to 15 years. Expanding access to this age group will protect them from serious illness, prevent further spread in families and communities, and support their return to more connected life, learning, and play. However, for the time being, regardless of our vaccination status, it's important to follow public health advice and keep up with individual precautions, even as we continue to see more benefits of COVID-19 vaccination. This Sunday is Mother's Day, and hopefully this year will be the last time we have to say it is safest to limit celebrations to immediate household members or to keep it virtual if you've already left the nest. Moms understand. They invented it's the thought that counts. And they'll tell us there are no limits on thoughts, tributes, trinkets, or macaroni and crayon cards. Let's thank all the moms for everything that they've done to care for us by washing our hands, wearing a well-fitted mask, and keeping safely apart till it's time for in-person hugs again. Next week is the start of National Nursing Week, giving us even more reason to do everything we can to protect ourselves and others, in a show of gratitude for the incredible skill and dedication of nurses and their healthcare workforce colleagues across the country. Thank you.
Hello, everyone. For the numbers update, we'll focus on the current weekly averages that tell us how COVID-19 is trending now. You can find more numbers and trends at canada.ca and discussed in our statements and tweets. This wave continues to challenge us, but we mustn't lose hope as the finish line is getting closer. The decline in national case counts has slowed to an average of over 7,700 cases reported daily over the past week, and the number of people experiencing severe and critical illness remains high. Over the past 7 days, an average of almost 4,200 people with COVID-19 were treated in our hospitals each day, including over 1,450 in intensive care units, and there were an average of 46 deaths reported each day. This week has seen a number of important developments on the vaccine front, including the announcement of significant increases in vaccine supplies starting this month. To date, almost 15 million doses have been administered, providing almost 42% of Canadian adults with a first dose of protection. As well, this week, Health Canada authorized the use of the Pfizer-BioNTech vaccine for safe and effective prevention of COVID in children aged 12 to 15 years. Expanding access to this age group will protect them from serious illness, prevent further spread in families and communities, and support their return to a more connected life, learning, and play. However, for the time being, regardless of our vaccination status, it's important to follow public health advice and keep up with individual precautions, even as we continue to see more benefits of COVID-19 vaccination. This Sunday is Mother's Day. Hopefully this year will be the last time we have to say it is safest to limit celebrations to immediate household members or to keep it virtual if you've already left the nest. Moms understand. They invented it's the thought that counts, after all. They tell us there are no limits on thoughts, tributes, trinkets, or macaroni and crayon cards. Let's thank all the moms for everything they've done to care for us by washing our hands, wearing a well-fitting mask, and keeping safely apart till it's time for in-person hugs again. Next week is the start of National Nursing Week, giving us even more reason to do everything we can to protect ourselves and others in a show of gratitude for the incredible skill and dedication of nurses and their healthcare colleagues across the country. Thank you.
Merci, Dr. Nou. Le premier ministre prendra 6 questions en commençant par le téléphone, une question, une sous-question. Les docteurs et ministres demeureront disponibles pour 15 minutes par la suite. The Prime Minister will be answering 6 questions, starting with the phone, 1 question, 1 follow-up. Doctors and ministers will remain available for 15 minutes afterward. Opératrice, c'est à vous.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 pour poser une question. La première question est de Lina Dib de la presse canadienne. À vous la parole.
The Presse Canadien. Hello, Mr. Trudeau. Could you please explain clearly why you are not asking for a waiver of patents? Answer. We understand very well, Lina, that this pandemic will not end anywhere unless it ends everywhere. That's why we've invested enormous money internationally, more than $1 billion, and in the COVAX Act Accelerator. And we are in discussions with other countries with regard to the World Trade Organization to come up with a solution. We know that there are several possible solutions. We're discussing our position currently, and we're trying to find a consensual position. We are all working together, and Canada will be part of the solution.
Very clear that Canadians understand that this pandemic doesn't end anywhere until it ends everywhere. That's why Canada has continually stepped up internationally to support efforts, whether it's being one of the original investors in COVAX, whether it's with the ACT Accelerator, over $2.5 billion now in international investments to help people get through this pandemic. We're, of course, continuing to work at the WTO on a range of discussions around proposals, and we look forward to moving forward on a consensus basis.
Follow-up question? You're talking about a consensus. What is frightening you? Is it that the pharmaceutical companies might make Canada pay if ever we take a position in favor of a waiver of these patents? Are you worried that the next vaccines will cost more, for example? You won't receive your doses? I don't understand your position. How did you reach this position? Answer. Well, my position is not based on fear. That's not what we're feeling right now. What we want, and Canada has always acted multilaterally, is to work with our partners to find the right solution to ensure that people have access to the necessary resources to get through this pandemic. This is a discussion that involves various different partners who have various different opinions. We're working with others around the world to come up with a solution.
I think one of the things that is very, very clear is that we are engaged wholeheartedly in these discussions on various proposals. We know that we need to work together as a world to get to the right place. There are different perspectives around the table from a number of different countries, and we need to work towards a consensus. That's the way the WTO works, but I can assure you that Canada is not interfering or blocking. Canada is very much working to find a solution that works for everyone. But I'm happy to turn it over to Minister Ng, who has been following, obviously, the work a lot closer as she's involved directly in it. Mary.
Well, thank you very much, Prime Minister. And yes, I can assure you that Canada has been at the table right from the beginning, working towards a solution on rapid access of vaccines to others in the world. We know that we're not going to be able to finish this pandemic unless we are able to vaccinate everyone around the world. And that's essentially the work that we're doing. And we welcome the news that came out this week, and we're encouraged that this may bring parties closer together so that we can reach an agreement as soon as possible so that vaccines do indeed get out to people around the world.
Thank you. Opératrice, prochaine question téléphone.
Thank you. The next question is from Marika Welsh from the Golden Mail. Please go ahead.
Good morning, Prime Minister. Following on that question from Lena, can you explain to us why you are not publicly stating Canada's position on whether it supports a waiver of patents?
Sure, Marika. There are a number of different proposals coming forward, and we're looking at, and of course we welcome the shift in position that the United States has brought. We need to work together because the world needs to establish a regime that makes sense, and Canada will continue to be there at the table with our arms rolled up on figuring out what the right path forward is. We're there to be part of the solution on ensuring that everyone gets vaccinated around the world. That's what everyone wants.
And how do you, thank you. How do you explain to the leaders on the world stage, to international organizations who are looking at Canada, saying things from your government that you do support equitable access, that you do want to support lower income countries, at the same time that your government is continuing to draw on vaccines from COVAX, which was primarily set up for lower and middle income countries that do not have access to these separate contracts that the Canadian government has, and also that the Canadian government is still negotiating with the U.S. to receive some of their AstraZeneca vaccines, instead of just looking at, for example, the humanitarian crisis in India and saying all of those vaccines should go there?
We have, from the very beginning, been one of the lead countries in investing in the COVAX facility, in the ACT Accelerator. We've invested over $2.5 billion to ensure equitable access to vaccines around the world. And indeed, investments we made early on in companies like Moderna with advanced purchase agreements, with contracts signed early on, were the kinds of things that allowed for an acceleration of the research that led to vaccines. So Canada has continued to play its part. The COVAX facility was always designed for people to both purchase vaccines for themselves and purchase vaccines for people around the world, which Canada has certainly done and will continue to do. Like I said, we don't end this crisis anywhere until we end it everywhere.
Thank you. One last question on the phone.
Thank you. La prochaine question est de Marie Vastel du Devoir.
Marie Vastel from Le Devoir newspaper. Go ahead. First question. Mr. Trudeau, it's still not clear to me what your government's position is on this waiver. I don't understand the hesitation on your government's part. If you're not fearful, if it's not fear motivating your decision, why not simply follow the U.S. administration's step and agree to the waiver on these patents? You said you're looking for a negotiated solution, a consensus. What solution are you looking for? What do you think the solution should be? Answer. That's a very good question, Marie. First of all, we need to emphasize that these are multilateral discussions with a great number of countries who all have different perspectives. I think that the change in the U.S.'s position will help us find a solution. Canada is at the table to help find a solution. We're not blocking any negotiations. We need to work in the right way to assure that, to receive assurances that people around the world will be vaccinated. And we are very clear that even if we have a high level of vaccination, even if we are managing our pandemic fairly well and have been for the last 14 months, we're all susceptible to variants from around the world, even if we protect our borders as well as we can. We need to completely eradicate this virus around the world. That's why we're extremely active in these discussions, but we're one country among many others, and we're eager to reach a consensus-based agreement. That's how the WTO works. Follow-up question? Yes, thank you. But how would you reach the consensus? This is what we want to know from you.
If you want to jump in because you've been involved in those discussions, that's fine. Mais donc, vous voulez une solution à consensus?
You want a consensus-based solution. You say you're not blocking negotiations, but at the same time, if I understand correctly, you do not support a temporary waiver of the patents at large. Can you please explain to us what would enable you to reach a consensus? How do things need to change? What is Canada seeking at the negotiating table right now? Answer. First of all, I'd like to emphasize that this work, that the WTO's job is to find a consensus, and that's what's happening right now. The U.S. has its position, the Europeans have their position, developing countries have other positions on the matter. We're working together to solve this problem. That's how we'll ensure that people around the world have access to vaccines as quickly as possible to be able to get through this pandemic. But I'm happy to allow Minister Ng to answer. Thank you.
Well, thank you, Prime Minister. And to answer the question, what are we trying to do? We're trying to remove all barriers to access to vaccines so that we can, whether it is accelerating production or the equitable distribution, IP and the positions that have been put forward to waive intellectual property, of course, are part of those discussions. Canada has been at the table right from the very beginning, working with our partners around the world on ensuring that vaccines can get out there. But some of the things that we've also been working on, Canada has been taking a lead as the leader in the Ottawa Group, working with many of our partners. And here we have a trade and health initiative, and there it is looking at the other issues to remove barriers to providing access to vaccines. That includes supply chain, openness and resiliency, export restrictions. So Canada has been at the table, working through the Ottawa Group, working with the WTO, and we're very encouraged by the news that has happened this week. We hope that this will bring parties closer together. We are very committed to doing what we have been doing from day one, which is to be a strong advocate for equitable access to vaccines. We absolutely want to be a part of the solution to ensure a speedy fight against COVID, and we believe that we need to do this together. But working with the WTO, which is a consensus-based organization, Canada is absolutely leading and adding a voice there, and we hope that we can get to that consensus, and we're very much looking forward to these very negotiations that are taking place.
Merci. On va maintenant prendre les questions dans la salle.
We'll now take questions from the room.
With CTV National News. Your Chief of Staff is set to testify about what she knew about misconduct allegations against General Vance. Given how involved Katie Telford is in your day-to-day, is it conceivable that she knew something you did not, especially when it comes to extremely serious allegations?
Katie Telford has been leading on these issues for many years now, and we are, as a government, extremely serious about allegations of sexual harassment, assault, and following the proper processes in it. I will let Katie speak for herself this afternoon, but I know that this was important for her to be able to share her perspective on these issues at committee. Katie,
answer repeated in French. Katie has been working on these issues, among others, for many years now, and is eager to share her opinion and her work at the committee this afternoon. But I will let Ms. Telford speak for herself.
David Aiken, Global News. Good morning, Prime Minister. You said it more than a few times that you want to protect women in the Canadian Forces from sexual misconduct. You want to give them the confidence to be able to report and discuss complaints. But if a woman does that, the odds are pretty good it's going to be two fellas who show up to interrogate the complainant. We've talked to lots of victims who say there's no empathy there. In the civilian forces, big civilian forces, Toronto, Vancouver, Ottawa, half of the investigators are women, and there's supervisors who are women in the investigation squad. In our military, 23% of investigators are women. You can change that tomorrow. Are you going to do that? Is that something that's important? That seems to be something. What do you think about that?
The situation in the Canadian Armed Forces right now is unacceptable. It is very clear that women and men who are victims of assault or harassment are not comfortable in coming forward, are concerned about repercussions on their career, on their lives, if they do come forward to denounce unacceptable behaviors. That is wrong. And that is something that, even though we have taken significant steps over the past years, enough hasn't been done. That's why we've turned to two extremely strong women to head up the response immediately, with both Justice Louise Arbour, who is going to establish paths forward for a long-term culture change in our forces. But instead of just waiting for her work to be done, we've also engaged General Jenny Carignan, who has been an extraordinary leader in the Canadian Armed Forces and will be able to ensure that as of right away there are better supports for anyone who chooses to come forward, and that they are followed up on with the right level of empathy and support that, as you point out, David, has not existed to this day in the armed forces.
Hi, Prime Minister. Tom Perry, CBC. A couple of questions about travel and the border. The Ontario PC Party put out an attack ad directed at your government this week, accusing you of not clamping down enough on flights coming into Canada. Your party put out a fundraising letter in response to this. So I know where Doug Ford stands on the border. I know where you stand on the border. But I'm wondering, what are Canadians supposed to make of the fact that Doug Ford's government, or his party, is putting out an attack ad in the middle of a pandemic, and that your party is trying to profit from it?
First of all, I have been very clear from the beginning of this pandemic that my focus is on supporting Canadians through this. Ontarians are going through an extremely difficult time right now, whether it was the challenges in long-term care homes for incredibly vulnerable seniors, whether it's the current spike in cases in the GTA and elsewhere. We are focused on supporting. We are focused on sending the kind of help necessary. We're accelerating rapid tests. Our focus is entirely on supporting Ontarians right now. But I recognize that the pressures that are on all Ontarians and that leaders are under a certain amount of stress right now. And some will choose to point fingers and lay blame and even engage in personal attacks. That's not my approach, and that's not, quite frankly, what Ontarians need. I'm going to stay focused on working with Doug Ford and his government on delivering for Canadians as concretely as possible. Last week, in my conversation with Premier Ford, I highlighted that indeed, if he has concerns around borders, we can look at, and we are more than willing to look at, the people coming into Ontario right now. As people know, we have shut down the borders to all but essential workers and a limited number of exceptions. We are happy, as I offered to Doug Ford, to look at those exceptions and further restrict it. I offered on ending international students' arrivals in Ontario. I offered around temporary foreign workers and agricultural workers. We offered to look at the compassionate exceptions. There is proportionately a very small number of people compared to past years coming into Ontario every day, but there is more we can do. And as I said last week when I sat here, Doug Ford asked me to restrict international students. There's been about 30,000 international students come into Ontario over the past months because they were approved by the Ontario government. If the Ontario government wants to do more to restrict the volume of people coming into Ontario, we are more than happy to work with them on it. But it's been a week since we've received that request directly from the Premier that they haven't followed up on, except with personal attacks, which doesn't make sense and, quite frankly, won't help Ontarians. Depuis les débuts de cette pandémie,
Answer repeated in French. Since the beginning of this pandemic, my priority, my government's priority, has been to be here for Canadians, to work hand in hand with the premiers of provinces and territories, and to respond to needs in communities across the country. And that's exactly what we've been doing, with millions of dollars invested, with the Red Cross, working with the Red Cross and the Canadian Armed Forces. We've been working hand in hand with the provinces and territories. Now, I know that things are difficult in Ontario right now, and it can be very hard on leaders in that province, a source of anxiety as well. For me, the solution is to work together even more to help people. I don't think it's useful in any way to conduct personal attacks or point fingers. I want to work with the government of Ontario to deliver for Ontarians. We have been there with rapid testing, with vaccines, with resources, and will continue to be there. When it comes to borders, I offered to limit the number of people arriving in Ontario, if this is a priority for Premier Ford. There are 30,000 international students who arrived in the last months, because they were approved by the Ontario government. There are exceptions, of course, to the border rules, temporary workers, compassionate cases. We're doing what we need to do to keep people safe. But if Ontario wants to limit the volume, the number of people who are arriving at their borders, we are here to help them. We've already eliminated more than 80% of people arriving at the borders by shutting the borders. But if Ontario wants us to do more, they need only ask. Last Thursday, Premier Ford asked me to interrupt arrival of international students. It's been a week now that we're waiting for a follow-up on whether this is actually Premier Ford's intention, if he intends to go ahead with this, or if there is other categories of people, and if there is other categories of people as well that he would like to be stopped at the border. We're waiting for news from him. Apart from all this, I am still here to work with Premier Ford, to work for Ontarians. I know that is what is on the top of people's minds. Are we here to help? I can promise you the federal government will always be here for them.
I'd ask you, though, about that fundraising letter that your party put out. And I realize it's not an attack ad. You're saying you're not engaging in personal attacks, but is your party not engaging in politics while we're still in the midst of a pandemic?
I think we Canadians expect, Canadians very much expect politics to continue to function, for people to continue to bring up concerns and do the work as elected officials in representing them. And the strength of our democracy remains important. And yes, we will continue. But I think Canadians also well know that our focus has been entirely, as a government, on delivering for Canadians, on being there to support Ontarians. And quite frankly, we're pleased that Ontario has finally moved on better sick leave support in addition to what the federal government has done. We're pleased that Ontario is finally directing more vaccines to hotspots. We're pleased that there is significant movement and on rapid testing. We are there to continue to work with Ontario. Our priority is supporting Ontarians, not politics. I think Canadians can see that.
Bonjour, Monsieur Trudeau, Juliane Lapointe de Radio-Canada.
Hello, Mr. Trudeau, Julia Lapointe from Radio-Canada. What do you have to say for victims who are waiting, who expected that your Chief of Staff would have asked questions about the allegations? Answer. My Chief of Staff will speak for herself this afternoon. I have tremendous confidence in her ability to do so. I'd like to quickly look at the facts of this situation again. The Ombudsman went to the Minister of Defense with allegations. The Minister of Defense did not receive these allegations. Instead, he sent them to the appropriate authorities. It's not appropriate for politicians to examine these allegations. He sent them to the authorities who did the rigorous investigation. He ensured that the Ombudsman followed up with independent authorities in charge of investigations. My office was aware that allegations had been sent to those in charge of the investigation, the authorities, but we were not aware of the details or the nature of these allegations. I think as a government, however, we demonstrated, and I'm sure that Katie will speak of this afternoon, we have demonstrated that we have always taken the victims' allegations very seriously, and that the alleged behavior was unacceptable. We will always support the investigation process. Yes, there is more work to be done. The men and women in the Canadian Armed Forces work across the country. They deserve to feel to have faith in their employer, to know that they will be taken in hand if they have experienced something and make allegations.
We need to remember the facts of this situation. The Ombudsman came forward to the Minister of Defence with allegations against the Chief of Defence Staff, which the Minister of Defence didn't receive himself, but quite appropriately forwarded directly or referred the Ombudsman directly to the appropriate authorities, because it is not for politicians to follow up and do investigations ourselves. Our job is to make sure that there are independent, rigorous processes able to follow up on any allegations. That was done in this case. My office was aware that there was an allegation, but not what the nature or details were of that allegation. It is obvious, though, that the fact that the Ombudsman didn't have permission to move forward with that allegation with the appropriate authorities, that survivors of harassment, assault, intimidation, don't feel properly supported by the system. We have made improvements in the system, but obviously there has not been enough done. And that is something that we are continuing to work on. We've brought in new processes and are ensuring that there will be a deep and real culture change in the Canadian Forces and across institutions in this country to better support anyone who comes forward with experiences that are unacceptable.
Morning, Prime Minister. Stephanie Taylor with the Canadian Press. Going back to the WTO issue, it's clear you don't want to publicize what Canada's position is on this, but can you tell Canadians what impact you think a waiver on patent protections could have on vaccine production?
We know that we don't end this pandemic anywhere without ending it everywhere. That's why making sure that we are providing access to vaccines to countries around the world is not just in their interest, but in our own interest as well. That's why we are participating in these discussions and why we hope to get to a solution. But I will turn to Minister Ng to follow up.
Thank you very much, Prime Minister. We certainly are going to be actively participating in these negotiations to waive intellectual property protection, particular to COVID-19 vaccines under the WTO agreement on TRIPS. We are going to work at the table with our colleagues and with the WTO, and we look forward and hope that those dialogues will result in a speedy resolution. But ultimately, the work we have been doing and the leadership we have been providing is very much about removing all barriers to vaccine access, whether it be production or supply chain or export restrictions. And that's the work that the Ottawa Group has been doing through the Health and Trade Initiative, which we have introduced into the WTO. So this is really work that we're doing with our colleagues, and we will continue to be doing that.
Thank you, Prime Minister. This is all the time you have with us today. We'll now go back to the phone for more questions. Opératrice, prochaine question au téléphone.
Merci. La prochaine question est de Hélène
Okay, and that is the Prime Minister of